Hello everybody, I'm Dr. Jeff Smith and I'm here to show you a little bit about the CTS therapy laser system and how to use that in your clinic. This should serve as a reinforcement for your installation and orientation, or even as a review for that. So the first thing I want to do is show you the carrying case that the CTS comes in. It's a heavy duty carrying case. There's 3 zippers on it, one that makes the suitcase actually thicker. You can use that if you need to pack some extra stuff inside, but typically that zipper remains in place. The 2 zippers that undo the suitcase sort of come around the back, and then that acts as a hinge. I sort of show you how mine is packed so you can see how yours can be packed. So I have 4 sets of Doggles in this compartment. I have a case for 4 heads in here, and then I have 4 of the safety glasses, 1, 2, 3, 4. Plus my surgery kit is here, and my some of my paperwork is in here, and then my foot switch for the surgery as well. So everything fits into the kit. I'm going to open up the laser case itself, so this is doubly protected by the suitcase. There's a piece of foam in here that just take out and set in the lid, and you can see how the laser sets in here. So it's easy enough to lift out, and I'm going to set it up here on the shelf, and then I just want to show you a couple of the other items that are in here. So I keep my surgical fibers alongside of the kit there next to the foam. That keeps them nice and safe as well. And then I'm going to get my plug out. Most of you will have a cart to put the laser on to move it around the clinic, and the cart will have an APC on it, a battery backup that you can plug your laser into so it can be mobile from room to room. If you don't have that, I suggest adding that. So that's going to conclude just the packing part of the laser, and then the next thing I want to show you is how the laser itself works, so we'll take a pause. Okay, the first thing we're going to talk about are the ingredients in the suitcase. So you're going to have 2 sets of glasses in the suitcase. One of them is the over-the-glasses model, so if you're already wearing specs like I am, these glasses fit immediately over the top. These are infrared protective glasses for the wavelengths in this laser, so you can't wear your Ray-Bans or your Oakleys. You must wear infrared protective goggles. We also have the regular glasses, which I will have Emily demonstrate because she's not wearing glasses. I call those the Bono style. So those are for people without glasses. Okay, you can hand that back. We'll get them back on in a few minutes. And then I want to show you the Doggles. You have a set of 4 Doggles, and the small dog Doggles is also the cat Doggles. But some people have a little bit of question about how this goes on. So when you put these on the dog, the short strap is going to go under the chin, and the top strap is going to go up over the back of the ears. We'll actually show you some animals getting the Doggles put on them. And again, there's Doggles that are not IR rated. These are IR rated, and it says so right on the lens, protect from the infrared light, so that is important as well to provide protection to your patients as well as the customers. As long as you're within a 4 to 5 foot area of the laser treatment, you should have on safety glass protection. Once in a while I will have an animal that can't or won't tolerate the glasses, either because of an injury or because of ear treatment, and I'll use a comfort collar. It's an e-collar, comfy cone, black, and I'll get one of those out and show you that in a little bit as well. So I want to show you the ingredients of the kit. You have the Doggles, you have the glasses. You're also going to find some paperwork that has in this paperwork ThumbDrive. That ThumbDrive has the software for your machine on it when you need to do updates. That ThumbDrive will fit into the port here on the back of the laser. You shouldn't need to put this into the laser unless you're instructed to do so by the home office when you have a upgrade or an update to the software. And instructions are in that envelope to say so. Also, there's a set of keys in here. You're going to get 2 sets of keys for the laser. So keep one in a safe place, lock it away somewhere. Your laser will not work without the keys. And then there is an instruction manual, although most of these instructions are included in the iPad software, which I find easier to access. One thing that is unique is this fiber cleaning card. So if we have the fiber detached, the fiber attaches right here on the back of the laser, I'll explain that in a minute. You would actually take the end of the fiber and wipe it across these little rectangular sections to clean the end of the fiber. So again, there's some other videos on that, but that's what this fiber cleaning card is for. And then again, an instruction manual, user guide, so if you want to look at the paper form of the laser instructions, you can certainly do that as well. like I said, I prefer the online instructions and the instructions that come with your iPad as well. Alright, I'm going to put this stuff back in the envelope. The other thing I want to show you on the laser is the back of the machine. So here's your serial number. That'll be important if you're communicating. There's a hole for the key to go in, and I'm going to put the key in at this point and show you how that works. This port right here is for the foot switch, and again, when we show you how to hook up the surgical attachment, that's the only use for the foot switch. This printer port, we don't really use at this time. The USB port, again, that's for updates, or if you want to export any of your treatment records to a thumb drive, you can export them in a PDF, and you just plug your thumb drive in there, and then you can export it to your computer. The Ethernet port, that's more used at the home office, and then this plug is where we're going to plug our laser in, and then we're going to plug the laser into the wall, which I'm already plugged in, so we're good there. And then I do want to show you the head holder tray on the back is magnetically attached, so it can come loose for easy cleaning. The fiber cord, we typically keep ours unwound all the time unless we're transporting it. So when it comes out of the case, we have it wound up, but anytime you activate the laser, you want the cord fully unwound. And this handpiece only fits into the holder in this direction, sort of facing to the right when you're at the front of the laser, okay? It's not bi-directional, so it doesn't fit in here. If you force it, you'll fatigue this plastic and it'll eventually break. And then most of the time what we'll do is just make 1 or 2 loops of the fiber and hang it up over the top of the laser so it's not actually dragging on the floor. So that is sort of the topology of the back of the laser. These vents should be cleaned from time to time. Same with the underside of the laser, vacuum that from time to time. And then I will point out the emergency stop switch, which is easy to see from this side, but you can see that from the front as well. I don't think I've ever actually activated that, but if you need to, you can pop it down and it will turn the laser off, and then to turn it on, you have to twist it in the direction of the arrows on the top to turn it back on. Typically we use the finger switch on the handpiece to turn the laser on and off when we need to stop it quickly. Okay, we're going to take a pause again. Okay, so now we're going to talk about the Buttonology on the CTS laser. I'm going to turn the key on in the back. One thing this reminds me of, it takes about 1 minute and 30 seconds for the computer to boot up and come on, and I do want to say that that key that is in the back of the laser, when you put the laser back in the carrying case, make sure you remove the key, because otherwise you'll bend the key, and it's a real trick to get the remaining piece of the key back out of the lock. So anytime you put your CTS in the box to transport it, you must pull the key out first. There's not a cutout in that foam, and the laser fits very snugly into that space, and so if the key is in there, the foam bends the key back. So you're going to see the laser come on here. It takes about 1 minute and 30 seconds to boot up. That's one of the reasons I like to have the alternative power source on the cart, so if I go from our treatment room to surgery, or from surgery into one of the wards, I can leave the laser turned on and in the cart, and I don't have to wait for this 1 minute and 30-second boot up time to come on the laser. When you're touching the screen, it seems to help if you use the pad of your finger plus your fingernail to aim where you're going. Alternatively, you can use the stylet that's included on the front of the laser, so you can pull that out, especially when you're entering names and numbers and so forth. The stylet seems to make it particularly easy. So you'll see me doing both things as we go. Alright, here we have the laser turned on. So the power off button sort of explains for itself, but in order to turn the laser off, do not turn it off until you've actually powered off and the screen has gone back to a black color. Then you can turn the key off and back, just like any Microsoft computer. You don't want to turn it off in the middle of a cycle without powering it down. On the front we have several buttons, and you guys can slide back, it makes it a little bit easier to see. So I'm going to explain the buttons that we use the least first. So the first is the setup button, and in the setup button we can select our aiming beam, our unit volume, and our finger switch. We always want the finger switch to on. The unit volume I prefer to have on low and beeping, but some people like it a little bit louder, especially if you're in an exam room or a quiet space for 20 or 30 minutes. A loud noise is a little bit annoying. And then the aiming beam, it's that red light that comes out of the laser that's not one of our therapeutic wavelengths. You can have that as steady or pulsed, and again, I like it as steady. It just reminds me that the laser is either on or about to be turned on. So anytime you can see that red light, it means that the laser is ready to fire or it is firing, one of those two conditions. When the red light is not on, it means that the laser is basically in a standby mode that you don't have to be too concerned about. So once you make those changes, you can save them. The other box you'll see down here is the 6-watt warning message off. So once you've had the laser for a month or two, if you get tired of seeing the message that says, make sure you have a big cone on when you're over 6 watts, you can have that message turned off. I usually recommend leaving it on for at least the first couple months, and we're going to leave it on for here. So I'm going to press my home button to get back to home. We've explained setup. So now let's look at the library. So the library has several interesting features on here. We have the CTS user guide, so any of the things that are printed on here you want to know that I was just explaining are in the back of that little printed paper manual. You can also look up here, so that's your CTS user manual. We can go down here to some case studies. And the case studies are sort of interesting. Say you want to look at one about terminal osteosarcoma, and you want to sort of see an example of that, how the laser was used in that situation. You can page through there and see the pictures and so forth. Let's go to the companion tab. So on the companion tab, a lot of this is just explained by tabbing through and looking at what it says. It'll give you a little bit of a table of contents there, showing you how lasers work, laser classification, laser physics, so on and so forth. The Pegasus tab has to do more with the equine side of things, so you can use this laser for equines as well, but whenever you see Pegasus, that designation means you're talking about equines. Okay, so let's look at the 3D anatomy. That one's actually sort of common to use if you want to demonstrate to a client a particular anatomic feature. So in this case I have muscles designated. I can hit the play button and my anatomy spins around. I can hit the pause button and stop it at any place and show a particular muscle that I want to. I can add nerves. Now I have nerves and muscle, or I can subtract muscle. So I can show any particular part of the anatomy that I'm trying to treat. Okay, and that is also available for cats and for horses. So those are probably the three less commonly used ones. The operation mode, again, this takes a little more experience, but in the operation mode of the laser, you can pick whatever parameters you like to set the laser up and get it going. So you can pick the time that you want to go for, the wattage that you want to go for, and then you look at the total number of joules here. So say if I increase my time there to 4 minutes and 30 seconds at 12 watts, that's going to give me a total of 3,240 joules. So if you knew that you wanted to use that number of joules to treat an area, you could do that through the operation mode. Again, most of the time when you start out, you're going to be either going through the protocol mode or through the patient tracker section, and I'm going to show those things next. Okay, we'll take a pause. Okay, we're back. Now we're going to talk about the two remaining buttons on the front of the laser that we haven't described so far, the protocol section and the patient tracker section. So first we're going to go to protocols. And in the protocols you get to pick your species. I'll say right now that feline and equine are only one size, and that the canine, there's 6 different sizes on that, so let's just see what that means. We pick canine. Over here we have 6 choices, so based on the weight. Let's just pick for an example a 60 to 80 pound black Labrador that's overweight, short coat, dark coat color, but light skin. That's relatively common. So all these different choices are affecting the dose and the wavelengths that the laser is choosing for your particular condition. I hit next, and now I have a list of all my conditions, and you can see it's a pretty long list: acupuncture, arthritis, edema, swelling, leg granuloma, wound, pain, trauma, post-surgical incision, fracture, pyotraumatic dermatitis or hotspot, rhinitis, sinusitis, abdominal disorder, urinary tract disorder, otitis, oral hematoma, gingivitis and periodontal disease, thoracic disorder, enosacculitis, perineal fistulas, and stomatitis. So if you don't have the exact condition, you can find a condition that's sort of close, and you'll probably come up with a dose that is approximate to what you want to accomplish. Remember, for all of our superficial conditions, we're treating at about 4 joules per square centimeter, and for all of our deep conditions, about 10 joules per square centimeter. An easy way to check that is a hand is about 3 by 5 inches, or about 100 square centimeters. So if you're doing a deep area at 10 joules per square centimeter, 10 times 100 is 1,000, so that's 1,000 joules. So my knee would be about 4 handfuls or 4,000 or 5,000 joules of energy for my knee. Say I had a wound on my leg that was as big as my hand, then it's 4 times 100, so 400 joules. So it's a lot less energy for superficial stuff. Anything you can see, you don't have to penetrate through. So why is the difference? Do those cells that are deeper take more energy? No, they take the same, but you lose about 6 joules on the way down. So instead of 4 joules is what you're treating this skin with up here, you start with 10, we lose 6 on the way down, so these cells still get 4 joules per square centimeter down here. So that sort of makes sense based on the physics of what's going on. The other thing I'll point out on here is there's 2 conditions that are similar, okay? So the gingivitis and periodontal disease and the stomatitis. Stomatitis is a little more severe, has a little more robust dosing. And then the anal sacculitis and perianal fistulas, those are also pretty similar. Again, the perianal fistulas are a little more severe type disease, so it's going to have a little more robust dosing to it. The other thing I will say, and we'll talk about this a little bit more later, but oral lesions like the mouth, you have a choice of open mouth or closed mouth, and I typically do both. I do one first and then the second. And for ear lesions, or the other oral, A-U-R-A-L, that also has, it actually takes you through both treatments, either open mouth and closed mouth, and on here it'll call it superficial and deep. So we do superficial with the non-contact first, and then deep with the contact, around the mouth and through the middle of the jaw and so forth. So those are the main things to understand about the menu. A lot of times, like on this Labrador that we're using as an example, we're going to hit the arthritis button. So anything that's musculoskeletal can usually be encompassed by the arthritis setting. That's a deep setting. It's going to be about 10 joules per square centimeter. I'm going to go to my next button, and it's going to show me a picture of the dog. And one of the really nice things about the companion laser is I can treat multiple joints at once. So I hit stifle, I hit hip, I hit lumbar spine, I hit thoracic spine. The laser will now give us those 4 treatment areas in a row. And it is important to go from distal to proximal as we do that, because we want it, on most dogs, we're going to do the knee, the hip, the lumbar spine, the thoracic spine, and then we're going to roll the dog over, and this program is going to start over, and we're going to do the knee and the hip on the other side, because you have 2 knees and you have 2 hips, but you only have 1 back, right? So we don't need to do the back twice because we only have 1 back. If I program it in reverse, I'm going to have to do the back a second time, which I don't really want to do. So always go from distal to proximal, meaning from the toes towards the body on the back end, or on the front end, you can go elbow, shoulder, thoracic spine, cervical spine. So you'll find in most cases when I'm treating the elbows and the shoulder, I'm also doing cervical spine and thoracic spine, and when I'm treating the knees and the hip, I'm also doing the lumbar spine, because the nerve roots that are going to those injured or inflamed areas are also involved in this maladaptive pain process, and you're going to get better results if you also treat those nerve roots as well as the site of the pathology. So let's, and you can see how if I change my mind on an area, I can just tap it again and it goes away. So let's go back to knee, hip, lumbar spine. I'm going to hit next. And so what happens here is that the laser always will tell you where you are. 1 of 3 treatment areas. Current treatment is a canine, 60 to 80 pounds, arthritis, stifle, overweight, short coat length, dark coat color, and light skin color. It's telling me my dose is 3,024 joules, and it's telling me it's going to take me 5 minutes and 15 seconds. So I'm basically ready to begin my treatment. And what I recommend for most practices is that you hit your max button, and I always keep my max button red, okay? And all that does is keep the laser in continuous wave the whole time. And what that means is the laser's on instead of blinking the light, so your treatment goes faster when it's in continuous wave. The exception to that would be if you had a really dark-coated animal that you felt like the coat might get too warm. You can leave it on without the max button, and that pulsing of light actually makes the energy come out more slowly, so then the coat doesn't get as warm. So again, with experience, you'll be able to determine what you want to do there. So what I do next is I hit my standby button. It gives me a warning. It tells me I have to have the large treatment head on because I'm giving it at a higher dose. And I should take a moment to show you that there's 2 sizes of treatment heads, okay? There's a large contact massage ball and a large non-contact head, so that's for above open wounds or stuff that you don't want to touch. And then we have a small contact head or massage ball and a small non-contact head. So these 2 heads are using anything below 6 watts, 5.9 or lower, and these 2 heads are using anything 6.0 or above. And all that does is spread out the energy over a bigger space so it doesn't get as warm as fast. So the whole key here is we have a lot of energy coming out of the end of the laser, and we want to spread that out over a reasonable amount of space so that the tissue doesn't get too warm. Okay, so it's warning me to have the big head on. I say okay. Now it's going to blink 5 times and beep over 5 seconds. Now if I press the button by mistake, oh, operator error, you pressed the button too soon. And you're definitely going to see this error button come up because this button is going to be pressed by mistake when people are moving the laser or putting it back. It's no big deal. I just press it again, and you can't feel whether the button is in or out. It just stays in the same position. But I hit exit, I try it again, it tells me the warning again, I hit OK, and now I'm not going to press it too soon. So my ready button here is flashing, and when it stops flashing, what I notice is that the red light comes on to the end of the laser. Okay? And that means that the laser is going to be activated now when I press the button. So at this point, we do want to be wearing our Doggles or our glasses if we're going to allow the laser to start emitting light. And one thing I want to talk about with that too is that if we're doing the treatment on a stainless steel surface, we want to cover it up with a towel so that's not reflective. We'd like to do it in a preferably quiet and isolated area like an exam room. If we can't do that, we want people that aren't wearing glasses or protection at least 5 feet away from us. And we want everybody wearing the protective goggles or glasses that's within that area, or covering the eyes with a dark cloth. If I had one other idea that I can't recall what I was going to say now for safety. Oh, the other safety element that you want to comply with is to have a laser in use sign posted. So we have those posted on the doors of our treatment area. And then also, it's a great idea to put one of those on your cart, so no matter where your laser is, you have a laser in use sign. So those are the two requirements: eye protection and a laser in use sign. Okay, we're going to take another pause. Thanks a lot.